So good afternoon, everyone. I've been asked to shed a different light on the application of mobiles for health based on our experience that we have in Africa. We've been in Africa for the last 6-7 years, implementing all kinds of interactive campaigns to deal with health, sensitization, awareness, data collection from health workers, from clinics, from remote areas, all in Africa. And we've now expanded also to South America and Asia, so the majority in emerging countries. When I look around in this Congress, and especially also, for instance, the Pfizer presentation just a minute ago, this is more or less the mHealth that we're discussing here in Barcelona these days. The only thing for us, and I think for the majority of Africans, mHealth is more about the example that I gave on the right. Simple, interactive, easy to understand, informative messages that they can really use to improve their health, their lives. So this is, for example, the first quiz and the first interactive campaign that we did in Uganda. We promoted the quiz via multiple channels, so television, radio, posters, things like that, to ask people to start participating in this SMS quiz, which was toll-free for them and available on all networks. So there's no discrimination on network or phone type, anything. Just asking them a question like, do you think a healthy person can have HIV, yes or no? And then providing feedback based on the answers. So either well done, or maybe you didn't do very well, wrong answer. And then also to motivate them to go to a clinic to get themselves tested. So it's not only about the feedback, it's also about the motivation to do something with that. And that's how you reach the social change eventually. It can also be different things, personalized messages like you have an appointment tomorrow at 9 a.m. at your local clinic, a medicine reminder to take the medicine, very easy, using SMS and voice, so it's available for both literate and illiterate audiences. And a couple of people might think, okay, mobile in Africa, what exactly is the potential for that? And I think that the potential is becoming more and more and bigger and bigger. And at this moment it's basic, but it's growing into smartphones very rapidly. I mean, the ground coverage is over 84%. Majority of African population has access to a mobile phone. The smartphone use at this moment is still dramatically low. I mean, there's countries like Ghana, Kenya, they're really on the forefront of innovation, but there's a lot of countries still in the basic mode of mobile. But it's an interesting consideration if you think that there's more mobile users than people that have access to a toilet in emerging markets now, or more access to a mobile than a bank account. So there's a lot of potential for mobile applications. And if these guys can be connected using a mobile, then I think we can reach out to the majority of population probably. So what are the key learnings or the main recommendations maybe for the mHealth projects that we set up and what we learned over the last 6-7 years? The first thing is really to understand the local context. So if you want to reach sustainable behavior change, understand who you're working with. So work with reliable, capable local partners, not only with set it up from Amsterdam where we're based, or DC or anything like that, but go to the ground and really see what's the need. Do a thorough problem identification. What exactly do people need? What kind of information? What kind of topics? And take time for your comprehensive program design. So the best programs that we're running, there's one in Tanzania where 500,000 people are interacting on a daily basis about pregnancy-related information. It took 1.5 to 2 years to set up the program for content design, promotional materials, tech. But it takes that time, and then it's good. You can start from the ground. You don't need a pilot for that. You can scale it up immediately. Plan your multiple moments for M&E, but because you're interactive on your SMS and voice, just adjust when necessary and not wait until your end of project before you do your M&E. So be flexible, adjust where required, modify your content, things like that. And realize that mobile technology is only the medium. It's not a cause in itself. So just keep it simple and serve that need that people really have instead of using mobile because it can get you another grant or anything.